Well, I sure appreciated the comments that were made. I think we're seeing a lot of changes out in the community right now. Labor shortage is a big one. My whole wheelhouse has been construction, and I'm mostly known for OSHA because I've dealt with 81 fatalities nationwide, and ICE raids, and sheriff raids, and everything across the country we get from I-9 audits. And we've really worked very hard, and that's what I've been known for the last 5 or 6 years nationwide, and we took the case to the Supreme Court about mandatory verify, trying to say states shouldn't keep adopting the immigration sanctions laws by state to make it difficult for construction and other companies and trades, and they shouldn't make mandatory, verify mandatory when it was voluntary. And as you know, it's evolved, and E-Verify is now mandatory for federal contractor jobs, which a lot of you would be involved in. But part of the new legislation that was mentioned, so I thought I'd dovetail on that since those comments were perfect. We do hope immigration reform happens. I think there's a big effort on that, and we think it really will happen. It will mean mandatory verify across the country. It'll be phased in. So there's a lot of us working towards those efforts to get immigration reform, because in construction we just don't have the labor, and a lot of projects are suffering right now without it. So AGC's been great. They've been a leader. They're always involved in it, and that's very important with our trade associations because they're the ones with the influence to make some of this happen. So we'll see what happens with it. It's an issue, and you know, we're dealing with a lot of things on that, and that's going to really spur our economy when we get that rolling. But one of the things that has now affected us in construction, a lot of people have asked questions about, kind of a dry topic, but an important one. And as Darla and I talked, I want to make sure I try to do it at a high level. I don't bore you before the reception, but we want to make sure you all want to drink by the time you get there, and so you'll show up. So usually we like to talk a little bit, you know, more interesting topics, but it is one that everyone's like, how does it affect my business? What if I have a union contract, a collective bargaining agreement, or my trades do that work on my construction sites as a GM? And what does it mean? How is this really going to impact? So we want to at least give you enough understanding so that we all know that as GMs you have a second in command back in your office, and they'll love these PowerPoints. So what you want to do is just grasp enough so you know to be dangerous and talk about it and understand the financial impact. And I think my other message is that somebody at your company is actually dealing with it with you. So there's a lot to it, but the PowerPoints we have that Darla will get sent out on the website has all the detail and more that I'm going to fly through most of them here so I don't bore you to death. But it is important, and you can, it's almost like you read through it, it's kind of like Teach the Trainer. You can read it all and figure it out with your people in your office who are actually dealing with some of these issues. But some of it you'll need to know. It does impact things. It impacts our undocumented workers, how the Affordable Health Care is going to impact some of them applying or not applying, because they actually built into this law, if you can believe it, a little provision no one's talking about, where undocumented workers get rammed if they sign up for health insurance at any of these trades or at your company, and they've made it on the payroll somehow, because we have 11 million people here without legal status who are working under someone else's name and number. They run automatically through the ICE system and DHS, and then they'll come visit you because they'll have signed up for health insurance. So a lot of people haven't been talking about that yet. So that's one of the things that will happen with this new law. So I'm going to try to give you some highlights. Please feel free, if you have questions, jump in. That's always fine, or we can wait till the happy hour. But I'm going to, so part of this, if you can bear with me, we're going to fly through all the slides. There's a lot of them here. We're only going to go to the ones that I think will be most important to you. First of all, what is this Obamacare? What does it really mean? Why did we change everything? Well, there was a big clamor for an outcry for trying to get some solution to health care. That we wanted, that the country wanted everyone to be insured, and not just the people who are uninsurable out there who were draining the emergency rooms and the state Medicaid and access plans. So what happened? We have 265 million Americans. They call it non-elderly. Do you like that? As we all move into that age, it's non-elderly now. So 148 million have employer-based coverage. Whoops, sorry. Now I'm doing what you did. Maybe it's better. We're having trouble with this mic, I see. 15 million with individual private insurance, 54 million on Medicaid, and 48 million were uninsured. Okay, and a lot of people were using up their lifetime maximums. So what happened is this is supposed to be kind of a safety net to catch everybody. But as you can imagine, one of the consequences would be that young people, young working construction guys, generally probably won't sign up for the exchange and probably won't sign up for health care. And then if they turn out to be undocumented on top of it, they're definitely not going to sign up. So we are still going to get a bit of a, only people who have a health issue are definitely going to sign up, and then the rest will as they mature and want to have coverage. But that's what prompted some of this. It was the major initiatives become effective in 2014. Individuals must enroll or pay. So every company is going to have to make a choice as we're marching down to 2014. Do you want to keep your health insurance plan, or do you want to pay into what's called an exchange and just pay a penalty to the government and let your employees pick that program? Okay? So people are worried about that because they don't want to lose their best management people, their superintendents, their office people, and they've been offering health insurance. So I have a lot of owners called last year and they're like mad, like, how can the government do this? I want to keep my same plan. I need to. And one strategy you can do, which is talked about in the PowerPoints, is you are allowed to offer multiple plans. So you will have your health insurance brokers, they're all learning it and getting up to speed as fast as they can. Everyone's trying to figure out what's the options for companies, but you'll offer several, or you can. And so there's one that's going to be like your minimum plan with minimum benefits you have to offer. Then you're going to have one in the middle that people can pay for that offers more. And then you might have the one that you want your key people to have so that they continue working with you. And you're not allowed to discriminate, right, on plans. However, there is a way that you can offer and do an FSA, a HSA plan where you can pay them more money, and it's just a bonus for the year, and it'll actually equal that higher plan they have right now, and you can limit it to whoever you want. So there are some ideas out there if this is a problem for you or your company or something you're concerned about. So you pay penalties or you play in the system. And there's a lot of, look at that last column there, a lot of federal subsidies for small business and lower income individuals, which will come into play. So that becomes a bit of a challenge as we look at some of the things. Basically, employers have an option. March 23rd, 2010 to January 1st, 2014, that's been the option, is you have a grandfathered plan or not, you have other employer group plans, you might be self-funded, or you take no coverage, you run bare, so that you can do anything you wanted prior to that point. Post January 1st, 2014, why are we even talking about this issue is it's coming right away. You have to either continue your grandfather plan, use an employer-insured group plan, so you have your own, but it has to meet certain requirements, and you'll probably do multiple tiers in order to make sure that you can provide everybody the minimum, like required by law, and then those that need more than that, because the minimum is not very much. And then you offer an exchange plan that's off the state system or the federal. Each state is supposed to do an exchange. So you will be able to go on to you can buy a bronze plan, a silver plan, a platinum plan. It's really true. It's all kinds of things, and you just pick your choices as a family or an employee. Or no coverage again, and then people can pay a penalty. You're allowed to do that. Now, I'm going to skip through a few more because you don't need to hear about the non-grandfathered plans. Some of you in construction always ask, what does it mean of collective bargaining agreement? Okay, because some of us represent union and non-union contractors, and so do I. So it's like, how does that impact? And right now, I've been going through some collective bargaining sessions with some of between the roofers and sheet metals. They have quite a few fights going on, but we've been having discussions, and part of my bargaining is, well, explain to me on behalf of this union contractor, who's already a union contractor, how is it this Affordable Health Act is going to fit in, and how is this going to work when we're arguing over the increases in pension and health benefits, and how is this going to work? And they're very concerned because, as your leader said, the aging construction group, they're in those health care plans, and it's going to cost more money if they keep running them. And so they're really worried about how this is going to impact, and they still don't have a solution nor a good provision. I gave them 2 different provisions to start thinking about on their national levels, to use for our union contractors, but they don't have it down yet, and they don't have one, because you don't want to be agreeing to something in your collective bargaining agreements, and then it comes in, and now all of a sudden you've got a big jump, and you had no idea. And you don't want to be paying into both plans, right? Because if you're a union contractor, you could be agreeing for your employees here, and then the union says you have a collective bargaining agreement, says you're going to pay in there. You could be dually paying. So you have to have some provision in those to be careful. But the situation is they did get exempted for a little while, so they got the break, okay? And so they're not having to do what all the companies are having to do starting January 1, 2014. So it doesn't apply to health coverage maintained pursuant to a collective bargaining agreement that's ratified before the enactment date. March 23, 2010 is considered the enactment date until the date on which the last of the CBAs relating to coverage terminates. So what you're also seeing is a lot of these older contracts, and even now we're trying to extend themselves beyond the time period to try to avoid it. So it's just something to know. There's something a little bit different about the union one, the collective bargaining agreements. The coverage requirements, mostly you've probably heard about them. There were big changes when this started. You had to have no pre-existing conditions. You have to cover kids till they're 26 that might be children of a worker. So there's just some differences. And then no lifetime limits. So that was in all your health plans to date. A lot of them had them about lifetime maximum. Those will be gone. So that means that, as you read in the newspaper, in the Wall Street Journal, all been talking about it, they're predicting a high increase in premiums for everybody. I mean, sometimes they're saying up to 35%, right? Who knows? At the end of the day, who knows? I think everyone jumps the price up in the insurance world because they don't know what to expect till they can stabilize it. But I think we're going to see increases. I mean, I don't think it is going to have the effect that everyone thought. So that's some of the things on there. Again, you have to extend benefits up to age 26. You have to do a lot of reporting. So the only reason I bring it up to this group is realize that the people who handle this in your office are going to go through quite a change for the next 18 to 24 months. There's all kinds of reporting requirements. The government's going to start monitoring. They're going to come out and do another set of audits if we don't have enough government auditors on our doorstep. Between DOL and OFCCP and all these auditors, now we're going to have yet another one through this law that's going to be coming out to do audits. It's almost like we've been having a lot of companies, depending on their size, really just start making someone a compliance director. Forget the HR titles. Find someone who's good at these things, can deal with auditors, can talk the talk, and help with that, because we've had so many of these. The other thing is no eligibility waiting period greater than 90 days. Okay, so that means that 90 days everyone has to be in. But you can do something that's in the PowerPoints when you really dig into the details called a variable employees. Like when you hire them, you're not sure yet if they're going to work out as a superintendent, a foreman, or whatever in your office. You hire them as a variable hours employee, saying you're not sure if they're going to be offered full-time at the end. You're testing them out. And that gives you 3 months to test them out. And then their time would start eligibility for the next 3 months, and it would be 6 months before you'd actually put them on the coverage, if you want to do that. You don't need to do that, but that's some of the ideas that are out there that are options. The other thing that you have to do in the new plans is, on the bullet points, cover preventive health insurance without cost-sharing requirements. So you can see why the costs are going up a little bit. You have to satisfy these appeal processes. Remember I said reporting, there's a whole bunch of reporting. So I just bring it up so you know that that's coming. You'll have people to help you with it, but it is another expense, another bit of a hassle on things. Patient protections, I like to put that in here on the bottom. No restrictions on selection of pediatrician, primary care physician, or OBGYN. So none of these restrictions anymore. We have to go in-network, out-network, all that goes away, okay? So these are some changes that will be pretty common and different. Unrestricted access to coverage for emergency treatment. So no longer it'll be in-network, out-network, hospitals, emergency rooms. It'll just be wherever. And no prior authorizations for obstetric or gynecological care. So what do you have to cover? What's new? Immunizations, pediatric preventive care, women's health preventive care and screenings, including breast screening, cancer screening, mammography, screenings for high blood pressure, diabetes, high cholesterol. All these things are going to be required now in the workforce. Complete list at healthcare.gov. So what are we seeing? We're seeing a lot of people buy those big vans. Have you seen the big RVs? And they're turning them into mobile units to come into your parking lots as this starts to evolve, to do all these screenings for you. So they'll be negotiating with your companies to do that, to cover the requirements, or with the insurance carriers that are out there. So we're starting to see that happen already. The only other thing here, the bottom bullet point, I brought it in here for that. Employer plans cannot favor highly compensated employees regarding plan eligibility or benefits. So it's not like you can have one that favors the owners or the management. But like I mentioned earlier, if you just remember, there's the concept that there is a way to pay a bonus to people, put the money in the HSA and let it pay the premiums, and that's not discriminatory. And they can have a higher plan like you have now, and then you have 2 or 3 others that are offered for everybody else to join in. So there are some ways you're allowed to still do things. The other thing is, last bullet point on this page is does not prohibit offering different benefits to part-time versus full-time employees also. So just wanted you to know a few items on that. I think that covers that one enough. You don't need to know that. Number 19, so this is the strategy option. So there's a bullet point or PowerPoint on 19 that if you like that concept, you can go back and refer to it with your team at your office. But basically, it's discriminatory to directly pay a higher percentage of premium for managers than others. So that's where the company can't pay it for them, okay? But you can provide the salary increase to key employees in recognition of higher premium costs, but cannot tie the increase directly to requiring the employee to use it to pay insurance premiums. So you get to offer the money, you tell them why, but they do whatever they do with the money, okay? I mean, once you give it to them, it's done. But it helps them. And you use a Section 125 cafeteria plan to designate them as pre-tax dollars so that it equals the same amount so it can pay their insurance premium. So this will get kind of tricky, but there'll be options. That's the way to do it if you need that resolved at your company. Now, I'm going to skip through all the coverage of adult children. Look at these claims and appeal procedures. Yuck, yuck, it's just a lot of stuff. Someone's going to deal with it. That's going to be, you're going to see a lot of people crop up with, these are all the notices. You have to do rebates for excessive non-claim costs. I'm just giving you a flavor so you can see how fun this is for your office. You have to issue rebates that can be applied for the premiums the next year or in individual accounts. I will tell you, I have one client who's an insurance broker, and they started 5 years ago on those wellness programs, and now United Healthcare this year is going to do a survey on their people. They started really heavy into a true wellness program, and they have individual accounts for each employee, and they're there to do smoke cessation, they do weight loss, they do everything. They have only in the office, in their break room, they have only fiber and good snack foods. They have the wellness people coming out all the time. They push people to do it. They pay them money to be a part of it. People are building thousands and thousands of dollars in their account. It's like, he's like, I got to go talk to people about this, and no one believes me. He's like, it's giving them a raise if you do it right. But it's a lot of work, and the insurance premiums to buy a true wellness program aren't as big a commission for the insurance side, so they don't tell you about all that. Now, he happens to be an insurance broker and owns the company. And they're doing great studies on them. All of their levels of cholesterol have gone just amazingly well, blood pressure down, weight loss down. So people who made fun of it in the beginning, their whole company with several hundred employees are now being looked at as a huge example, and it gave all their employees a pay raise. But that's a little tricky and complicated, and you have to have people who understand it and are willing to be open-minded to do it, because again, the insurance companies, insurance brokers, even he's one of them, you don't make as much commission on those kind of plans when you set them up. So it's kind of interesting how that one's playing out. So that's just about premiums. So what are your options? One, continue a grandfathered plan after 2014, buy a health plan through the private market, and then qualified health plan through exchanges. Exchanges are available for small employers, that's 50 and under, beginning in 2014. Large employers beginning 2017. So they're phasing it in as you go down this path, but there are things you have to do now as a large employer that actually impact this. So you can't use the exchange quite yet. One other thing I mentioned was the maximum waiting period of 90 days, and there's a requirement that individuals enroll or pay a fine. So this is what went to the Supreme Court, is how can you do this, and how can you make people for being alive, you know, and working in the workforce or just being here in America, pay a fine if they don't have, you know, insurance. Because, I mean, we all talked about the auto industry. We have penalties about, you know, you have to have mandatory auto insurance in some states, right? But you don't have to drive and don't have a license on the road, you know, to drive. I mean, if you choose not to be on the road or go get a license from your state to operate on the highways, you don't have to pay an insurance. This is very different, right? We all have to pay it no matter what. Everybody does. So, and there's penalties that are quite high. Initially, they're not very high. It's like $95 the first year. After that, it starts indexing up, $6.95, and then it's going to keep going. So eventually, it's going to come off the tax returns, so people may notice it, may not notice it. So we'll see how this goes, and it's going to keep going up if they don't participate in it. So they have to do it through one of the 3 programs, and that's a requirement. Those without coverage face the greater the dollar penalty. There it is on the bottom. I remember I marked this one. 2014, $95 or 1% of income. 2015, it's $325 or 2% income. And 2016, it's $695 annually or 2.5% of income, and it's going to keep getting indexed till everybody signs up. Because they're worried it'll be an adverse risk pool, right? All the young people that are healthy are never going to sign up. Everyone who's got a health problem is going to sign up, and it's going to cost more for the whole system. So that's some of the things they're trying to work for. Oh yeah, I wanted to put this in here. Certain individuals are exempt from the fine for failing to carry the medical insurance. So what does that mean? Some people in religious groups, undocumented immigrants, and that's where we talk about it. They're exempt. But they may not sign up. You won't know because, of course, we teach you all to do I-9 forms and use E-Verify if you have to and all that. But they won't sign up because it runs through that they hadn't told everybody. They run them automatically through DHS or Department of Homeland Security system. So a lot of people are spreading the word, and the unions and civil rights groups will spread the word for them not to sign up. However, if we get comprehensive immigration reform, one of the provisions in there is in December, if you've been in this country as of December 2011, that's the current provision in there, you will be able to immediately apply for registered provisional status to work in this country, like right away when the bill passes. So this is going to flood the communities because, right, we have 8 to 11 million people to get on the payrolls. they're on payrolls, but to get on the system in there. So they are putting that in there as a current provision, and it's going to be automatic and very quick. So we hope that that stays there. So anyway, that just tells you members of Indian tribe exempt, certain people at certain levels. So just to give you a flavor. And we're not going to go through the subsidies. Everything's in there. I'm going to just fly through these just so you know they're there. Large employers, different definitions in the law, very inconsistent. You're a large employer with 200 employees or more, and on another provision in the same bill, it's 50 employees or more. So very inconsistent. So don't think someone learns the role and they know it. It is different and different requirements. It's $2,000 per full-time employee. It excludes the first 30 employees. So what does that mean? So if you're a large employer, over 50 employees to start out with, you automatically have to get the coverage. And if you have employees that also receive a premium tax credit. So let's say your employee just goes off and gets subsidies and says, I qualify and I want a subsidy. Now they just put your whole system into play here. But anyway, you pay $2,000 per full-time employee. That's what FTEE means. It excludes the first 30 employees. So you really have to sit and pencil it out with your workforce, how long they've been there, what makes the best financial sense. And there's a lot of analysts that are out there. We work with a lot of them that just take your dates of hire and your employees and that kind of thing, and it goes from there. So keep that in mind. I think that's all on that. You guys, what has happened is we told everybody a year ago when this started happening and nobody thought it would stay. And these calculations, look how much math is involved, right? It's like I was telling everybody that's in the healthcare world and in the HR consulting world and the payroll world, start developing the computer programs that people can just kind of plug and play them at work and figure this out, because it really isn't that simple and you can't just manually be doing all these calculations. Then the other thing is, what did I want to use here? Oh, the 6-month look-back period. Okay, here's another squirreliness to this law that, again, you'll have people in your office help you, but you have to designate transitional periods, administrative periods, the look-back period for how many employees you have now, and what is your average month that you want to use, a 9-month period to say their average work hours? Because as you read in the newspaper, what's the average hours? If someone works 30 hours a week or more, 30, then they have to be covered. It's full-time, it's not 40. That's one of the big changes of this law. It's 30 hours or more. So a lot of people, you saw a lot of controversy in California, for those of you in California, because and the unions were very upset, and they're like, everybody's knocking employees down to 30 hours, 28 hours a week, really, because we've got to be careful they're not over 30, right? So they started moving the Starbucks employees down and the Bevmo employees down, and everybody's being told we can't let you work more than 30 hours in a week, because otherwise we have to cover you on health insurance, and you're really part-time, and they were viewing them as part-time at 28 or 30. So a lot of companies are moving people to about 28 hours a week if they're in that gray area and they don't want to cover them with health insurance yet. And so what's happening is we're lowering hours worked for people at jobs they had in a tough time in the economy, and they're actually picking up 2 jobs. So most people are going to 2 jobs at 28 hours a week here and 28 hours a week there. And that does avoid overtime if they're working at 2 completely different employers, but that's what's going on out there, and that's the controversy about it. So that's just to remind you that there's these periods you're supposed to be memorizing now, and not memorizing, but implementing now